We're here today to talk about optimizing home health and care transitions, and really about the role of the home and community care delivery system, and specifically home care's role in really maximizing care transitions.
The biggest excitement for me was seeing some of the people that were going to be here, knowing their background and their enthusiasm around bringing key people together to work on a common vision. And really, this is a great first step in hopefully many more steps to come.
I think it's different because it's really set up to engage the members of the industry. So this is not about talking heads describing what they think the future might be, but rather having this collection of experts and hopefully collaborators who are going to really take the best ideas from a collection of people, multiple lenses on an issue.
This kind of is a symbol to me that we are finally coming of age and we're able to talk at the highest levels in designing our healthcare delivery system. It's all the thought leaders from around the country and the larger providers of home health care that we're all coming together to really form a common understanding and some plans for action to help patients transition from hospital to home, from nursing home to home.
This really represents the fulfillment of a promise. In 2008, when Dr. Chasson assumed the presidency of the Joint Commission and the Board of Commissioners met, they refreshed our mission to not only include a thorough and credible evaluation of organizations, but also to inspire excellence in the practice of healthcare. And to that regard, to promote organizations' abilities to achieve high reliability. Meetings such as this form the foundation on which to build those practices.
Well, I think this is a critically important topic, to help to reaffirm and also look to the future in terms of home care's role in managing the transitions and in reducing hospitalizations and improving patient outcomes that matter. These topics are critically important right now as new payment models and new regulations and a new environment is being created in Washington Road.
Where financing is done, regulation is done at federal and state level is so important unless we meet as a group and present recommendations as the hospital industry does and the physician groups will be minimized. We won't be able to make a contribution like I know we can to improve the quality of health care.
We have a mobile workforce of nurses and therapists across the nation, and we truly make a difference in patients and people's lives every day. And just taking the best practices that we have seen researched over the last several years and implementing them in a strategic way across the community continuum to build value.
So the real value for home care I see is that as the population ages, as there's an anticipated shortage of primary care physicians coming down the pipeline, really we're going to have to look to home care as another resource for physicians and care providers in general to be able to work with patients in their homes around organizing and motivating patients to take a more active role in their own care.
Oh, well, the focus here is about how do we keep people at home, people that are sick, that have a number of medical problems. How do we keep them independent, at home, families intact, healthy, doing well, and that's exciting. And using new care models, new technologies, teamwork, cross-venue care to make a difference. That gets me fired up.
I'm very excited because I really see the possibility for home health care to really make a difference in the delivery of health care in this country. Moving from facilities back to the home where it all started. It's lower cost, it's preferred care, and we have better outcomes with the patients. And with modern technology and the development of really robust home health agencies, I really think we're able to make a large difference in the delivery and help better care at lower costs in America.